Hello everybody, let's discuss the important questions for BPCC 111. Unit wise, first unit important question is differentiate between normality and abnormality. Second one is define psychological disorder. Discuss the usefulness of a classification system of psychological disorder. Discuss the two classification systems, that is DSM and ICD. Unit 2 define psychopathology, discuss the causes and risk factors of psychopathology. Question 2 discuss the different approaches to psychopathology like behavioral approach, cognitive approach, behavioral approach, cognitive behavioral approach, biological approach and psychodynamic approach. Unit 3 question describe the key concept of application of the humanistic approach to psychopathology, or this question may be asked in this form like according to humanistic approaches, what are the possible reasons for development of maladaptive behavior? Next question, the most important one, that is discuss the familial and cultural factors behind psychopathology. So you have to discuss what are the familial factors behind psychopathology and what are the different cultural factors. So in familial factors, you can mention in your answers the points like uh, yearly deprivation and trauma, inadequate parenting styles, marital discord and divorce, that are related to family. So these are familial approach. Next is cultural approach like unemployment, low socio-economical status, discrimination in race, gender, etc. Next, unit number 4. The question is define clinical assessment and describe the types of clinical assessment. Block number 2, unit 5. Question is childhood depression. Another question suicide. Another question oppositional defiant disorder and conduct disorder. In all these questions, you must write your answers in certain defined steps, and those steps are the clinical picture of the disease, the causal factors or etiology of the disease, what is the intervention or treatment or any prevention method for this disease. Like if you are asked in your examination about childhood depression, you must mention the points like first is clinical picture. This heading must be in your answer sheet. You must write about the clinical picture in this heading. Next one is etiology, or what is the causal factors behind this. Next, intervention or any treatment or any prevention method. So you remember the question in unit 5, that is the childhood depression, suicide, oppositional defiant disorder and conduct disorder. Similarly in unit 6, the most important unit I must say, because here the question are autism spectrum disorder and attention deficit hyperactivity disorder. You must know about this as you are a student of psychology, child psychology disorder. These are the most frequent and most important two sensitive disorders find in the little tots. So ASD, that is the autism spectrum disorder, and ADHD, that is the attention deficit hyperactivity disorder. Similarly, in these questions, your answer must have the headings like clinical picture, causal factors or etiology, the prevention method or any treatment. Unit 7, we have the question explain the clinical picture, causal factors and treatment of intellectual disability. The disability which are related to intellect, like the mind or your brain, those disorders generally intellectual disability. Next question in this unit 7, we have the specific learning disorder. You must know about the specific learning disorders which are related particularly to the learning. like the disorders like any children is unable to read or find any difficulty in reading, or that is called dyslexia. And if he or she is find difficulty in his writing, then you can say he is facing dysgraphia. If anyone is fear for mathematics, then he is in dyscalculia. Similarly, much more, you can simply read it out in your textbook, or you can search these terms that are I have written the important questions. You can download the PDF from our Telegram channel. And just so we have completed unit 7. Next, move to unit number 8. Define panic and discuss the components of fear and anxiety. Next question, define phobia. PHOBIA, phobia. DSM-5 provided 3 categories of phobia. Discuss about them. And the 3 categories are specific phobia, social phobia, agoraphobia. And again, the specific phobia are 5 types. Okay. In phobia, you can write the causes of phobia, or if the question are asked about phobia, what is the cause behind it, your answer should be on this format, like biological perspective, psychological perspective, environmental perspective. These 3 perspectives must be framed in your answer when you are writing about the causes. Anything, any disorder cause, your answer should be in 3 headings: biological perspective, psychological perspective, and environmental perspective. That's because your answer should touch all these different sides, so that you will provide the answer much more catchy, as you are answering the question, not just remembering the facts, but you are providing the right data, like and you are touching the different sides of answer, like biological perspective, what are the causes behind it uh, in the view of biology, and what is the cause in view of psychology, what is the cause in the view of environment. Next, you have to write treatment of phobia, like any therapy or any medication. Okay. Next disorder is GAD. You may be asked in your exam about GAD. In any short note, you may find GAD. So, what is GAD? That is the generalized anxiety disorder. The main hormone that is responsible for this GAD is the CRH, that is corticotropin releasing hormone. That is the main one hormone which is responsible for anxiety hormone. You can say it is an anxiety hormone which causes GAD. So CRH causes GAD. And if anyone is facing GAD, so which can provide relief to that. So that one is the GABA. So what is GABA? GABA, that is the G for gamma, A for amino, B for butyric acid, A for acid. So gamma amino butyric acid, which can give relief if anyone is facing GAD, generalized anxiety disorder. So 2 things you have to remember: CRH and GABA, that is GABA. So CRH, where it is responsible for this GAD, GABA is responsible for the relief from GAD. Next question. Before moving to next question, another important term you can mention any of your answers, that is comorbidity. 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 So what is comorbidity? If someone is having 2 or more disorders, then we can say he is facing comorbidity. Okay, so when 2 or more disorders or illness occur in the same person, then it is called comorbidity. Okay, next question is social anxiety disorder. Another question is panic disorder. Similarly, in this question you must remember the previous format that I have told you before in your answer. Which headings you must include? That is the clinical picture, the cause or etiology, and next one is the treatment or any prevention. Okay, next unit 9, the disorder is obsessive impulsive disorder. Next question, body dysmorphic disorder. Unit 10, we have the disorder dissociative disorder, somatic disorder, and convulsion disorder. Next, come to unit number 11. We have the question, what is feeding disorders? Feeding, that is related to feeding or eating. Okay, discuss the features of anorexia nervosa and bulimia nervosa. That is an important one. You must know about these two terms, that is anorexia nervosa and bulimia nervosa. These two disorders are related to feeding. Okay, when any child is very much insecure about his health, his looking, that how I am looking, if he or she is getting fat, then he is feeling like, why I am getting fat, I must be low it. So in this case the child eats very low. This case, it is the anorexia nervosa. And in the another thing, that is bulimia nervosa, that is the binge eating, or the child eats very much. Okay, he just eat more and more, that is the bulimia nervosa. When the child is starving, it is called anorexia nervosa, and he or she is eating much more, it is called bulimia nervosa. So the question may be in the form of differentiation, like differentiate between anorexia nervosa and bulimia nervosa. Similarly, a binge and purge cycle in bulimia nervosa. Next question, clinical features of binge eating disorder, causal factors plus treatment. So in this unit, simply you must know the two terms, that is anorexia nervosa and bulimia nervosa. And this unit 11 will be complete. You can answer any question from these two terms. Okay, finally we are in our last unit, that is the unit number 12, and it is the very much easy for everybody, I can guess. First question is about stress. So you can write about stress, its stages, like stress stages like alarm stage, resistance stage, exhaustion stage. So the first stage is alarm stage, when it is just mild, not very much, it is just mild. Okay, the stress is very low, just the alarming stage. But the next one is resistance stage. Here the it is much more than alarm stage. Here the child can fight back from the stress. His or her body is capable of fighting from the stress and get back to normal. But the third stage of stress is exhaustion stage. Here the child is unable to fight from the stress. Okay, his body is unable to fight. Next, you have to write the types of stress, like acute stress, chronic stress, positive, negative stress. So if you find any question from stress, you can simply write its stages, its definition, and the types. Next question is trauma and stress. What is the origin of this stress or trauma? So origin may be from the womb stage, from the mother's womb, or during the developmental phase, or you can say after birth, or any during any life situation or any circumstance. So they may be the origin. Next question is important, that is PTSD, that is post traumatic stress disorder, PTSD. Simply you have to define what is post traumatic stress disorder. Question is management to stress and trauma. How you could manage this stress and trauma, uh, and how to manage this type of related disorders. So in the management, you can write the techniques, different techniques or any therapies which are responsible, which are helpful in this management of disorders, like debriefing, cognitive behavior therapy, eye movement and desensitization, supportive therapy, relaxation techniques. Okay, so these are the techniques for management. And somehow if you are not able to recall these things, you can simply write the known facts. Okay, but try to put some headings, the beautiful headings for your answer. That will fetch you much more marks. Overall, I felt this subject is simple. Also, you can write the management techniques. You in the management techniques, you can write yoga and meditation. You can write other relaxation techniques. Okay, so we have completed all